Thank you for joining us today. We're going to do a very brief video clip over something that may seem fairly straightforward, but I think there's a few points surrounding that are worth talking about. So the contents inside the package is sterile. Our hands are clean once they're gloved. The package is very easy to open. It's well marked in the corner, so you raise the corner and you pull it away from yourself, which will open the package. Now, by opening the package now inside is now clean. We just pick up the syringe, which comes out very easily, and again we'll see that there's the body of this syringe, and at this end is the plastic hub, which is capped, and everything inside there is sterile. With the other hand, what we want to do is pick up the needle. The contents inside the package and the needle is again sterile. So to connect the two, it's a very straightforward process. We want to take the cap off of the needle, remembering that the end of that is still sterile and we want to keep it sterile so we don't touch it. We want to take the cap off of the hub of the syringe or the lure lock, which you can now clearly see is a very generous lure locker hub, which is why it can easily accept any size of cannula or needle, which we know as injectors is very important because sometimes we use needles, sometimes you use cannulas. Then what's the next step, what we want to do is we want to hold the cap of the needle, appreciating this end is sterile. We want to hold the hub of the syringe, not the body of the syringe, the hub, but we don't want to touch the end, which is again sterile. We then bring the two sterile parts of the system together. And then the important step, which is very simple but critically important to remember, is while we hold the hub still, we actually turn the needle so that it threads into the hub. And basically now I'm applying quite a significant pressure on the end of the needle, and what I realize that it can't go any further. That means the system is locked. So now the needle is still sterile, and the syringe is clean, and I can put it on a clean surface as I prep the patient, and everything inside there stays sterile till I'm ready to inject. When I'm ready to inject, I actually pick up the syringe, and then I just pull straight on the cap, and now the cap is removed, the needle is firmly attached to the syringe, and the needle is still sterile, and now I'm ready to inject. So now that we know the proper way of attaching the needle to the syringe, I just want to show you some of the problems that we can encounter if we do it in a different direction. As I said earlier, to get the plastic to fit to glass, it needs to be what's called a friction or a pinch or a pressure grip, meaning this plastic can slide on the glass. And it's meant to do that, and it will do that. The problem is, like everything, is the more we use something, it wears out, it fatigues, and that would actually allow it to dislodge from the glass more easily. So we really do not want to turn this hub any more than we have to, because every turn means that the pin or the friction grip is actually getting weakened. So the mistake that is commonly made is if we hold the syringe and apply the needle, and then we turn to get it tight, then what can start to happen as we turn further, you can see that the hub is now turning on the glass syringe, and that's going to weaken that connection. And the more we do it, the weaker it will get. And therefore, if that gets too weakened, when we apply pressure on the plunger, the weakest point is the connection between the plastic lure lock hub and the glass syringe, and therefore they can disconnect at that point. The other thing that can happen is that we can be deceived into thinking that we have a tight connection with our needle, when in essence what happens is we may have misaligned it, and because the hub is now spinning, we think that the connection is tight and secure. And if we actually trust that, then when we start to inject again, we have a weak spot between the plastic hub and the needle, and product can leak out there. And so by knowing that those two things can occur, it's very, very easy to avoid it by, again, holding firmly onto the plastic hub, holding the cap of the needle and twisting the two together till we're not able to twist anymore. We meet resistance. Thank you very much for your time today. I hope this was informative.